So, good afternoon, sir. I'm Mondano. I'm your physical therapist for today. How are you?
Good.
Can you state your name and birthday, sir?
Wednesday, September 21.
Okay, thank you. So, for today, what we're going to do is we'll be conducting a range of motion test. So, this is to know if that segment of your body is moving within its full range of motion, and we'll be conducting a manual muscle test as well, particularly on your left forearm muscles to know if there are any muscle weaknesses present or any underlying conditions that you should take note of. So this activity will require me to touch you. Would that be okay, sir?
Yes.
Okay. So, but before we proceed with the assessment proper is, I'll have to take your vital signs. So this consists of your blood pressure, pulse rate, respiratory rate, and as well as your temperature. But before I do that, let's sanitize first. Okay. So at this point, Miss, assuming na ni-take na ko sa vital signs ni patient, and I'll be proceeding to the assessment proper. So now, sir, is we'll be doing your range of motion test first. Is I have here a ruler, so this is what you call your goniometer. So this is what I'll be using to measure the degrees of motion available in that segment. So in this case, I'll be measuring the degrees of motion as when you move your thumb. So, okay, sir, can you please put your hand on top of the table? So straighten your fingers, please. So what I want you to do here, sir, is I want you to move your thumb away from your palm as far as you can. Sige, sir, move daw, sir. Okay, na. So I'll be placing the goniometer. So in the placement of the goniometer, Miss, fulcrum will be placed at the lateral aspect of the scaphoid, and then the proximal arm is in line with the lateral midline of the second metacarpal, and the distal arm is in line with the dorsal midline of the first metacarpal. So, okay, sir. I'll be stabilizing the metacarpals, Miss, and the carpals to prevent any wrist motion. So, sige, sir. Is this the farthest that you can go?
Yes.
Okay. I'll be measuring it. So now, sir, is I'll be moving your your thumb passively. So to know your passive range of motion nga passive range of motion nga measurement. Okay. Okay, good. So now, sir, that would be it for our range of motion. So in the normal thumb abduction, sir, katong motion, the measurement is 0 to 70 degrees. As when you did the active range of motion, katong ikaw ang naglihok, your measurement was 0 to 50 degrees. And now, sir, as when I did the passive range of motion, katong ako na naglihok, your measurement was 0 to 60 degrees, which are both were within the normal range of motion, which was the 0 to 70 degrees. So now, sir, we'll be doing your manual muscle test. So for your manual muscle test, we'll be testing your left forearm muscles. So can you hand me your forearm muscles? Sige, sir. This one. So position your arm sa inani, sir. So I'll be holding your elbow, ani, sir, ha? So what I want you to do here, sir, sige, sir, is from this position, I want you to move your arm into this position. Sige, sir, can you please do that, sir? Sige, sir. Okay, again, sir. Okay, now I'll be holding your elbow. So now, sir, I'll be applying resistance. So what I want you to do is I want you to resist the force that I'll be applying. So I want you to move your hand from this position into this position, disregarding the resistance that I'll be applying overall. Sige, sir. So in the count of 3, I want you to do the motion. 1, 2, 3. Okay, good. Now, 1, 2, 3. Okay, good. Now, 1, 2, 3. Okay, relax. So that would be it, sir, for our manual muscle test. So we have this grading system, sir, na apply. So we have grades 1, 2, 3, 4, and 5. Under the grading system, sir, your grading would be grade 4. So that indicates nga there were no muscle weaknesses present or any weaknesses present as when we assessed your muscles. Kaya you were able to hold the position when I applied strong to moderate resistance. So that indicates nga normal reduction, sir, and no problems at all. So that would be it for our assessment for today. But before I let you go, so I'll be taking your vital signs first. So at this point, Miss, assuming ni-take na sad ko sa vital signs ni patient and palakwan na nako si patient. Okay, sir. So that would be it for today. Thank you for your cooperation and for coming as well. So see you in the next session. So paglakaw sa akong patient, Miss, kay ni proceed yun ko og aftercare, and that would be it, Miss. Thank you.